Thursday, July 29th. I'm Jessica Lovell. Welcome into the Morning Medical Update. We will get to your COVID questions here in just a few moments. COVID continues to take a toll on cancer patients that have delayed annual screenings. The Masonic Cancer Alliance, or MCA, they are helping with a free skin cancer screening next month. We're going to tell you how you can register for this free event a little bit later in the update. But joining us today, oncologist Dr. Gary Doolittle is here to answer your cancer questions, and of course, Chief Medical Officer Dr. Steve Stites in the house again.
Here to cause trouble.
Always. All right, we're going to get right back to you, but let's first get to our co-account, Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. Good morning to you.
Hi, thank you.
How are the numbers looking today?
Numbers are holding steady as far as hospitalized patients here at the health system. We have 35 active patients with 17 in the ICU, so it went up a little bit, but 7 on the ventilator. So that number is kind of really just stayed steady. At one point, we were up to more than 50% of our ICU patients on the ventilator. It's kind of come down a little bit. We still have 24 additional patients who have met that discontinuation criteria, so a total of 59, but again, 35 active patients. We know Hayes has 6 active patients with 1 in that recovery period as well, and 1 of those active patients is intubated. So.
All right, thanks for that. We're going to get to reporter questions for you here in just a moment. Dr. Stites, you've got some info for us.
Yeah, so this is from kansascity.com, and I just thought we ought to take a look at this together with our audience today, because this is a graph. It's the rolling 7-day average for what we've seen here in Kansas City in the Core 4. The Core 4, remember, is like Wyandotte, Johnson, Jackson, Kansas City, Missouri. And what it says is that our numbers really are going back up. So if you look at the different waves, the first wave is the one we had very early on. You can see that. Then mask mandates kind of went into effect. We leveled off. And then last fall, things really peaked, right? And we saw that rapid surge, and that's when everything in our healthcare systems were really pushed by that. And I don't want to say we were completely overwhelmed, but we had 250 patients either acutely ill with COVID or recovering from COVID out of our 800-bed hospital. That's a very large number. And then it trickled down, and then you can see where it was at the bottom. And then you can see the mask mandates came away, and then we started seeing the Delta variant in the wastewater. That is not just a coincidence. That's really important, because now you see the numbers rising again, and the peak is almost, one could look at that graph and look at the slope of that rise with so many unvaccinated people and with the Delta variant, which we're going to talk about here a little bit more in just a moment. But with that Delta variant, that slope of that rise is going to be our second highest peak. What we have to do is prevent it from being the third highest peak, or the first highest peak. And the way to do that, and we've been saying this along, you see the cities starting to take notice, right? Because they know the information is out there. They're seeing, they're concerned about it. North Kansas City and Kansas City, Missouri are both going back to mask mandates. The CDC is recommending that both vaccinated and unvaccinated wear masks indoors, and there's a really good reason for that. And the reason is that the Delta variant is different. Is it more deadly if you get it? Yeah, probably not. Is it more dangerous because more people are going to get it? Yeah, that's probably true. And I think one of the challenges is, and Hawk, you talked about this yesterday, it looks like the viral load inside your airway is 1,000 times greater with the Delta variant than with the original strain or with the Alpha variant. What does that mean? Well, it's actually really high in those who are vaccinated and those who are unvaccinated. And one of the fears is that even though the vaccinated folks, like ourselves in this room, are very unlikely to be hospitalized or to die from it, much less likely than those who are unvaccinated, we may still be spreading it. And that's different than it was with the Alpha variant and the Wuhan variant. And we don't know for sure, but that's really the focus of the question. So come back to that graph. The Delta variant takes hold, we don't have mask mandates, things are starting to climb, and we all may be shedding and spreading. The question then becomes, what do you do about that? We can prevent illness and death, or help prevent it, significantly reduce it with vaccination, but it's going to take masking to prevent us from shedding and spreading, Hawk.
Yeah, I think there's a lot of points there. You're exactly right. The vaccines do still provide protection. We've also heard that the CDC has some unpublished data showing that. We'd still like to see it. I think a lot of people like to see it. What we were referring to is kind of a small study from UK and China that a lot of people are using. So we still want some more information. But also what we're seeing, directly to your point, is really now 2 pandemics. It's the pandemic of the vaccinated, but even greater is that pandemic of the unvaccinated.
Unvaccinated.
And to your points, the sheer numbers, even in the vaccinated, sure, we see infection. What were the main goals of the vaccination? Not necessarily to prevent infection, because really infection is just that virus getting into your cells. But what it was to prevent COVID. And COVID is the disease, and it's the whole spectrum of disease. And what they have shown is that the vaccinations do still provide great protection versus that whole spectrum of disease of COVID, especially that severe disease, and even those symptoms that even have to need you to seek medical attention at the hospital. So the vaccines continue to work, but now we are seeing, and there was a great illustration, I believe, last week in that article in the Washington Post, just showing the rates of unvaccinated versus vaccinated, the case rates, the hospital rates, and that's what we're seeing.
Yeah, I totally agree. And the only thing I would add to this point is that graph that we showed you that demonstrates what happens with unmasked folks and with the rise in the Delta variant is that we have to prevent that. We have to prevent these curves from happening. How do we prevent the curves from occurring? How do we stop these new mutations from getting a foothold just like this? How do we stop it? We stop it by getting vaccinated. That's how we do it, because vaccination really can help prevent that virus mutation inside your body, and that's what keeps getting us into trouble. If we had been highly vaccinated, the Delta variant would never have had the opportunity to take hold as it has, especially here in the Midwest and other areas where there's a lot of unvaccinated people.
Yeah, and I think, I saw an article yesterday, either Washington Post or New York Times, so I don't want to be wrong in my and who did it, but they looked at England, because we know that England recently has had a loosen up of restrictions on a lot of people who are predicting that there would be a great number of cases, but they do have a high vaccination rate in all of their eligible people. And so what they've seen is actually case rates have decreased. And I think it owes to the vaccination rates there. And we need to continue to get our vaccination rates up in every community.
I want to get to some reporter questions. Cody from Channel 9 has one. I'm going to read it for him. A few viewers are trying to say that people don't need to worry about COVID because we are at herd immunity. Is this true? What's the real threshold, and what do people need to keep in mind?
Well, we are clearly not at herd immunity. The people in Springfield could clearly testify to that. You see so many people in hospital, 300 patients hospitalized in Springfield with COVID. You watch our rising numbers. Yeah, we're not at herd immunity. And I know what people want to believe is, oh yeah, so many people have got it, plus some of the folks who are vaccinated equals 80 or 85%. It's pretty clear that if you've had COVID once before, you're still susceptible to the Delta variant, so that herd immunity doesn't work. And secondly, the proof is in the number of infections, the rate of rise in hospitalizations, and the rate of rise in deaths now, because deaths are up across the country. So yeah, it's not herd immunity yet.
And herd immunity really historically has been, if you gain immunity either through natural infection, which again, even if you've had mild or no symptoms or low symptoms, your immunity is not as great to COVID-19 or SARS-CoV-2 as it is with vaccination. So first of all, that is just as you had said, low immunity. But also herd immunity historically has been up to 80 to 85 or 90% of the total vulnerable population, in which if you do have immunity there, we have considered that herd immunity. You have to remember, there is still a large segment of the population, pediatrics, people under 12, who don't even have the ability to get the vaccine. So that is all left out. So to your point, we are nowhere near close to herd immunity at this point in time.
Other questions?
Hi, this is Dan Cohen over at 41 KSHB. I was asking about the lack of capacity restrictions in the new mandate. I know the CDC hasn't issued new guidance on that. I just was curious to get your thoughts on that, if you think those are coming, if they're needed, if they're not. I know that was a key talking point early on in the pandemic about how many people are allowed in certain indoor spaces.
Yeah, so I think we can probably address this by standing in our lane around medical and health-related stuff. And Hawk, reflect on this. I think the answer to this question is, from a medical standpoint, is distancing better? Yeah, you bet it is. We know that that's true. From a public health perspective, is it better? Sure. From an economic perspective, that's why they have elected political leaders who don't sit in white coats and media shows and talk about medicine and science.
Yeah.
I think our challenge is that we know what, from a medical standpoint, as a purist, what's the right thing to do? Yeah, distancing plus masking equals really improved public health measures. But I also know that that's going to put a lot of impact on the economy and on folks' jobs and on the ability of restaurants and others to complete a recovery. So I think it's probably a balancing act, and I suspect what the folks are, where people are landing and where the CDC really landed is, we're going to try masking first and see if we can blunt it, because we've got vaccination plus masking, and then see if that slows down the rate of rise of the pandemic. And if it doesn't, then they may have to add another measure. That's my guess of how they're looking at it.
Yeah, I agree. I mean, I think we don't just apply that to public spaces such as restaurants or other gatherings. We apply that to the school systems as well. We know the medical and public health guidance and science and what works to keep people safe. And so we can continue to support that. I think it's those other measures and those other things, the economics and other issues, that you have to keep into account. But it is masking, distancing. Do that to the extent that you can. Luckily, we are still in warm weather, although it's very hot right now. Luckily, we are still in warm weather, so you still have that ability to do a lot of things outdoors if you can.
In the shade, and watch out for skin cancer.
That's right. Wear sunscreen. I think from the medical standpoint, we know what keeps people safe. We know what keeps kids in school. How can we blend that with everyday life to continue to get back to normalcy? To keep doing those things that we want as a society, to keep children in school, because we know the benefits of that. But it is masking, it is distancing. Now we need to put all that together. But I think the most important thing is to continue to endorse the vaccination message.
Totally. Vaccination and masking, we can whip this thing. We know how to break the curve, not just bend the curve, folks. Let's break the curve.
Other questions?
Yeah, we have one from KSHB, and their question actually, doctors, is related around the heat that you mentioned. Does it make people, they want to know, what are some advice and tips for the high heat? Are we seeing a lot of heat patients here in the hospital, and does it have any impact at all on COVID virus?
I don't know that it impacts COVID virus. I wish it did. We could make it all go away when we hit 100 degrees.
Yeah.
But in fact, if you sit back and look at the outbreaks right now, there's a huge outbreak in Arizona and Utah as well. And it's very hot there, and yet they're having a viral outbreak. And it's because they're not vaccinated. And so I think the vaccination is the key, unfortunately not the temperature. We've seen rises in the virus when it was cold and rises in the virus when it's hot. It really just has to do with new variants and lack of vaccination. Are we seeing heat-related problems? You bet. Mostly in the emergency room. Most of those folks get adequate treatment. The answer is what we've always said. The more chronically ill you are, the older you get, and are very young, you have a harder time responding because sometimes your body's ability to notify you when you're dehydrated and things, it's not as strong as you get older, and you can't necessarily go get water when you're really young. So the key is, make sure that those who are elderly and the very young are staying well hydrated and trying to stay in as cool a place as possible. And if you don't have air conditioning, a fan and then shade. And outside of that, normally we tell people 8 to 10 ounces are 8 to 10 8-ounce glasses of water, 64 to 80 ounces a day, is what we have in normal weather. It's hot like this, you got to go up higher than that. You may need 100, 120, 140 ounces of water a day just to stay hydrated and to stay safe. And again, if you have chronic illnesses like cancer, and I can't wait to talk to Gary Doolittle in a moment, but you just got to really work hard at hydration and make sure you take care of yourself.
Great tips. Okay, community, send in your questions. Jill's standing by for those. We'll get to those here in just a few moments, but we, of course, now want to start talking about skin cancer. We know these last few days have been super hot. And Dr. Doolittle, I just wanted to ask you, does the sun intensity, kind of that old myth of, if it's cloudy out, you don't get the exposure, but does this hot sun intensity have anything to do with how much your skin is absorbing those rays and make it more dangerous?
Good question. It really isn't about the temperature as much as it is about about the intensity and the UV radiation exposure. The worst times during the day are between 12 and 2 p.m. So in order to protect yourself from the sun, it's really about avoiding, if you can, from 10 to 12. And then when you are out, protect yourself. Sun protective clothing, sunblock, sunglasses. Protect yourself from the sun if you are going to be out.
And hey, Gary, can I just ask you a quick question?
Sure.
For those of you with red hair or formerly red hair, Dr. Doolittle and I have known each other for
It's been a
approximately
long
a very
time.
long time. Is it worse? But it is worse for people who are really fair-headed.
Yeah, actually, blonde-haired people, red-haired people, blue eyes, fair skin, we don't produce the same kind of melanin as a patient or person that tans. The melanin we produce is not as effective or protective against UV radiation, so yeah, we're at greater risk, and for that reason, we have to take greater caution to protect ourselves,
Even when you lose the red part.
even when you lose the red part.
Yeah, tell Dr. Hawkinson he's going to lose it one day.
Yeah, he is going to lose it one day.
You're not
I
going to
think
look
it's
that way
made up.
forever.
It's
What,
like
are you still putting stuff in your hair? What are you doing with that?
now it's like a ginger gang or a post-ginger gang right here.
Oh, my
A long
goodness.
time ago, when I had hair and it wasn't gray.
Hey, Dr. Doolittle, I was just saying, well, you got a shout out from Rob and Debbie Hendricks. She was on
great.
Facebook. She was saying, awesome doc.
Great.
We know you're an awesome doc, too. That's why we have you in. So anyway, so how often should we be getting our skin cancer screening? I told you today you'd be proud of me because mine is scheduled for 1:30 today, the full body check.
Well done. Well done.
So how often should people be doing it, and who should be doing it? Is it do you have
Right.
to have a history? What's up with that?
Yeah, typically, we would recommend once a year if you're of average risk and there aren't any particular predisposing conditions that would put you at risk for cancer. So patients that are immunosuppressed, patients that have a history of skin cancer or the worst form of skin cancer, melanoma, the frequency of skin checks will probably be more than annually. It could be every 3 months, it could be every 6 months. It's a conversation you would need to have with your doctor.
Okay, so what can people expect from these screenings if they've never done it before? I know when I go, I tell my doctor, we get very friendly because I'm like, I want every single head to toe check. Don't leave out anything. What can they expect from that if they've never done it?
Yeah, that's great. Typically it's a head-to-toe exam, and the team will put you in a gown, and they're going to check every area of your skin surface. And the reason for that is, for the most part, we can't check ourselves completely. We really have to rely on a provider to do that. So you can expect the head-to-toe exam or the hashtag get naked thing when you go to the doctor, and it's really a good thing because you really want every single area of your skin tested or examined.
And
Yeah.
I mean, under your toenails, under your
Totally.
fingernails.
Yeah, oh, in between my
some of those
hairline.
funny orifices where the light never shines.
Yes.
Those places, the things you got to go to check, right? And
right.
I have to get it all the time.
Like I said, I see one of our new providers today. I said we're going to be best friends when this is all done. But that's okay, right? That's
It
how,
is
that's
okay.
how you
That's
get it
what
done.
you want.
That's it.
So our own Dr. Ronald Chen, chair of radiation here at the health system, was first author on a recent study published in JAMA Oncology showing that 9.4 million, there was a drop of 9.4 million in breast, colon, and prostate cancer screenings during this pandemic. Dr. Doolittle, do we know where skin cancer screenings ranked on that list?
Right. We don't have data that are as complete as Dr. Chen's. We have a recent report suggesting that our skin cancer diagnoses dropped between 43 and 46% during the most intense COVID period. And that's really worrisome because, like many cancers, diagnosing skin cancer early is the key to not only cure, but to the procedure that you have to undergo to effect a cure is less invasive. So it really is all about screening. Right, and getting in. And we just had a problem with COVID, particularly in dermatology. I think their patient flow, the challenges of getting patients in and out of the clinic were really tough. Now, of course, we're back on track, which is great, and we really still want to encourage everybody to think about skin cancer checks at least once a year for most of us.
Do not wait. Okay, so true or not, skin cancer is the most common form of cancer in the U.S.
Absolutely true. We have over 5 million cases diagnosed per year in this country. And if you look at the worst form of skin cancer, melanoma, it's about 200,000 cases. So again, I cannot emphasize the primary prevention measures that we take by avoiding the sun and the skin cancer screening events.
And I just want to ask you, is it sometimes the thing when we were looking at our bodies and checking stuff out, sometimes it's the things you don't think would be anything alarming. What do you want people to know about that? About what, how do you decide if something's just a mole or a mark? How do you determine?
Really good question. I think if there's any question at all, you seek out your provider and have them take a look at it. And from the provider perspective, if there's any question at all, we're going to do a biopsy. So I think, again, if you see a mole that is changing, if you have a skin spot that is bleeding or itchy, new or changing, yeah, get in and show that to your provider. Again, I think the threshold to biopsy is going to be pretty low. Better to biopsy and know for sure than to wonder.
Last quick question. We're going to get to community questions here in just a second, and Dr. Seitz, jump in on this too. But what's the impact on patients and just the healthcare system overall when we put these screenings off, certainly during a pandemic?
You want me to take it first,
Go.
Steve? Yeah, I think the big issue is for so many cancers, it's about diagnosing at an earlier stage or diagnosing when the cancer is, quote, new. So for breast, colorectal, prostate, it's just really important to get in and to be screened. And we know through Dr. Chen's study that there was an absolute deficit or an absolute drop in the number of screenings, and that's going to translate into diagnoses at later stages. It's going to unfortunately translate into a higher death rate for that cohort.
I think that's really the key. And, we heard from Dr. Jamie Wagner, our breast cancer surgeon, about already seeing later stage breast cancers. And, those are just things you don't want to have to do because your chance at a full recovery is just lower. And that's not where we want to land. Don't let COVID cause collateral damage to you. Don't delay these things that we know make a big difference.
Absolutely.
All right, so MCA is an outreach network for the University of Kansas Cancer Center. It has a long history of offering free cancer screenings across Kansas and Western Missouri. You can get one of those screenings at Skin Safe Saturday, August 21st from 8:30 a.m. to 11:30 a.m. here at the health system. It's at the Medical Pavilion, 4th floor dermatology clinic. You do need to register, though, for this at this bit.ly link, Skin Safe Saturday 2021. The link is also going to be here on our Facebook page, so please take advantage of that free screening that we are offering. Very, very important. All right, so what is on the mind of our community viewers this morning? Jill, let's get some of those questions going.
Cindy wants to know what the doctors are recommending for cancer patients since we have the Delta variant. Any added recommendations regarding vaccine or masking?
Yeah, good question, Cindy. For cancers across the board, we are avidly, strongly recommending vaccination. And then I think all the practices that we had going at such a positive rate, so to speak, masking, distancing, hand washing, continuing to do what we did before, but make sure that we're really compliant and we're sticking with it.
I think one question that's probably going to be out there is whether or not we should do a third vaccination at some point for cancer patients and for people who are immunocompromised. I think that's going to be a hot topic. And, Hawk, I'm going to bet we're going to land on doing that third vaccination, and I bet it's going to be cancer patients especially. It'll be one of those high-risk categories. I'm going to bet that's going to come out sooner rather than later.
Yeah, I have a meeting today with the Cancer Center actually about that. And, of course, our best data for that is with the solid organ transplant patients. We still have some other data from other immunosuppressed patients, rheumatologic patients, and stuff like that. We have to be careful. We have to really understand what is the emergency use authorization, what does that allow for, what are the patient burdens as far as financial and things like that. Overall, the vaccines are safe. We know that. So I don't think there's a safety issue there. But we have to look at all those regulatory things as well as the current data behind all that.
Yeah, and I think what it also means is that we have to wait on the FDA to say that we can do that, because if your point about it's under an early use authorization, we're not supposed to prescribe outside of those guidelines. In fact, they're stricter on that than they are when it gets fully approved. But you just hear the tilt out there, right?
Yeah.
The Pfizer's starting to show some of their data now. The Israel has already moved. A few other countries have moved to that. Yeah. They have presented to the CDC and the FDA. I don't know. It just feels like that's the drumbeat. We'll see. I may be completely wrong, because on my part that's a guess, but I think that's where I think that we're going to end up landing there.
And we overall want to do what's right and what's best for our patients, but we also do that under what is currently allowed under the regulations of the FDA and stuff. So we will look at that.
And we are seeing, there is a little bit of a drop in Pfizer's. There was some data that came out yesterday about the drop in efficacy oh gosh, I got to get this number right. I think it's like 5% every 2 months in the vaccine or thereabouts. And so if you are 95% efficacious at 6 months, then you tend to be about 80% efficacious. And the problem is when you then dive into who it is most efficacious, well, it's still the folks who are more healthy and versus the folks who are sicker and probably didn't have as good a vaccine response to begin with. I think that's going to include cancer patients. I bet we're going to do another one. I bet it's going to be after about 6 to 8 months, but we're going to have to wait on the FDA to make that decision.
All right, Marcia's asking, with a shortage of beds and staff, is there also a shortage of medications?
We don't have a shortage of med. We have so much vaccination right now that sometimes it expires on our shelves. That breaks my heart, people. Don't let that happen. Get yourself vaccinated. But no, we are pretty well supplied on medications right now. And I think that, fortunately, the U.S. and American supply chain had a good comeback as the numbers went down, hospitalizations went way down. So we're prepared for this wave outside of making sure we have enough beds. Because remember, we have all the other illnesses back full throttle, and it's a busy summer without COVID-19. With COVID-19, it's, we're all your hospitals in Kansas City are running at full throttle, and we're all having to turn down transfers we would normally take from outlying areas that need our help. I was on a phone call yesterday, and there's a patient from one part of Kansas who had to go to Salt Lake City. So, that kind of stuff, we just don't need to have that happen, and we can prevent it with masking and vaccination.
Peggy wants to know, can vaccinated people get long COVID?
I don't think we know that yet, Hawk. When we talked earlier this week about it, the odds of it appear to be a lot lower.
Yeah, we believe it's less because, again, the goal of the vaccination is to protect against that whole spectrum of COVID-19, from asymptomatic to severe disease. It looks like it does that very well. I think those questions need to be asked specifically to really get those answers. Asking the question. So first of all, looking at who is fully vaccinated. Did you get COVID-19? If you did, are you having long haul symptoms? I think that is a specific question that needs to be answered. So very good question. Was actually just emailing Dr. Comfort and Dr. Spikes now about that question specifically. So we are still waiting for the.
He was on the program earlier this week and had not seen vaccinated patients in his clinic yet.
He did say that.
Yeah. So.
Well, and anecdotally, haven't they said that the vaccine does help people, maybe sometimes with their symptoms?
Yeah, again, if I get my chance to put on my crystal ball, which is terrible and doesn't work very well, as my wife and family would tell you, but I think we're going to find that the COVID vaccine really helps prevent long haul syndrome. Now, if one of these variants comes along that overcomes vaccination, then that's not true. Which is one more reason to do what? Get vaccinated so we can prevent variants and prevent more long haul.
Yeah.
Jeannie wants to know, the patients in the hospital with breakthrough infection, did they all have the same brand of vaccine?
No, it's all vaccines, and that's true nationally as well. You're seeing it with J&J, Pfizer, Moderna, and internationally you're seeing it with the AstraZeneca vaccine and other new vaccines, Novavax as well.
Rita is asking, do you know anything about Germany stopping giving the vaccine to people under 30?
Yeah, I've not heard that. Let me research that and be smarter, Hawkeye. You and I can tackle that. Have you heard
And
that?
it says
Take a look.
Israel
I
and
can't
UK.
believe that would happen. I can't believe that would happen.
Yeah, I've not heard that. I'm not,
Especially as most countries, more of the countries that have those access to vaccines are seeing more and more younger people who are getting the disease because they aren't getting vaccination because they don't feel that the disease is going to impact them.
And interestingly,
but we'll look that up.
Well, plus the European Union, which was well behind the U.S. and being vaccinated, now is pulled even or is ahead of the United States. And man, if they weren't giving it to those under 30, that would not be the case. So we'll verify. I'm not sure.
Well, I'm also going to ask her to tell us where she saw that, because we want to make sure we're not following the made-up news network, right? Kathy wants to know, why are some school districts not going to mandate masks for when school starts? She's writing in from Joplin and Carthage, and what your thoughts are.
Why are some schools, say it again, please?
Why are some school districts not going to mandate masking?
Yeah. I think
I live in Joplin and Carthage. She wants to know what you think about that.
Well, I'm a masker, so I like people being masked in public settings because I think the Delta variant is very real. But a lot of this is local decisions in the United States, right? You get to make local choices, and that school board has weighed all the considerations, I guess, and made the decision that they don't want to mask. I think the right thing to do for public health, and again, I can only speak medically here, the right thing to do is mask as much as possible, including in schools, because the Delta variant, we know, is causing a lot more disease in children than the original variants did. And we're seeing that at Children's Mercy. They're full. They have a lot more COVID patients this time around. And I think they're a little nervous. So my sense is we should all be masked in public spaces. The one thing to point out, though, in the print yesterday, when the CDC made their announcement, is if you're in a group where everyone's vaccinated, you don't have to wear a mask. So that there is that caveat that if everybody's vaccinated, now we know that all kids aren't vaccinated, ergo, my sense is everybody ought to wear a mask because that's what's going to ultimately keep everybody safe, especially folks back at home. Those kids can take that disease to their elderly parents or moms or folks with skin cancer.
Fair enough.
Angela writes, have you seen patients that have had COVID before, they're unvaccinated, and now they're in the hospital with the Delta variant?
That's a good question. I was just talking with our molecular lab director today, Dr. Leisman, as well as one of our other infectious disease doctors, Dr. Ella Truney, looking to get that study. I think that would be a great study to look at because, again, people believe, oh, I've had it in the past, I should be immune, and so now I can get it again and I'll be okay. I think that's a great study to ask. Hopefully nationwide that study is being done. I think it'll be very difficult to recruit and get those patients, but I think that's a great question to ask. If you were infected before, you're unvaccinated, and now you get reinfected with Delta, what are those outcomes? I think we do need to learn and understand that. I don't think there's any data yet on that, but that is a great question, and we are, again, just actively looking for maybe starting something like that today. But even here, if we just did it at our health system, I think the number of people would be extremely small. That would have to be a multi-center study I think you would need to do.
Can I get back to that question? I found the answer on the European things. They may limit the AstraZeneca vaccine to those who are under 30 because of clot. That's been out there for a while.
Yeah.
Because there's an increased clotting risk under 30 years old from the AstraZeneca vaccine. That is not true with Pfizer and Moderna. And actually, it's still very low risk with the AstraZeneca vaccine, but they're saying, use the messenger RNA if you're under 30. That's the message.
Yeah.
Gotcha. Jean is asking, can vaccinated without symptoms carry a high viral load if they have COVID and infect others? No symptoms, vaccinated.
Yeah, that's a very good question. We don't know the answer to that. The CDC has kind of stated that a little bit in one of their reasons to, re-endorse masking indoors for vaccinated people in unpublished data. I think we would all like to see that. So I think we're waiting for that answer. I don't think we have any clear answers just yet.
I don't think we know for sure, but I think the answer is going to be, what's different about the Delta variant, and we just have to be honest, the Delta variant is much easier to transmit. If you get it, we don't think that your risk of death is higher, but we think your risk of getting Delta is very higher, which could increase the number of deaths, and that's the problem we face. And the thing, because there is so much a higher number of amount of viral shedding in your airway. When you cough, when you breathe, even when vaccinated, you may be shedding the virus that could be spreading. And we don't know that last statement fully yet, but the dynamics of the infection appear to make that true. And we just have to look a little more carefully.
Yeah, and just remember, we do have a very small study from China and the UK looking at I believe unvaccinated people in Delta, and that was what showed, maybe you were replicating 1,000 times more virus than with Delta than with others. But again, I think there's caveats to that. Number one, it's a small study, although it was done very well. Number two, are those what they're seeing, is that truly infectious virus, or are you just picking up mRNA? So I think we're still waiting for the full answer to that question at this point.
Yep.
Okay, Lori wants to know, is there any reason that an immune-compromised person should not get a booster if offered?
There we go. That's a good question. Let's ask Dr. Doolittle that first.
Actually, from the cancer perspective, no. when we give chemotherapy or we give high-dose treatments and we immunosuppress a patient through the process, we're still recommending vaccination. The challenge is whether or not you're going to get the response that we hope for if you were immunocompetent. But the bottom line still, all major organizations across the country for the cancer patient population are strongly advocating for vaccination.
Okay, but third vaccine or just vaccinate the first two?
We haven't gotten to the third vaccine yet, but certainly for vaccinating
overall.
Now.
Yeah.
Overall.
Yeah, and I think that's right. And I think we don't know yet, but the organ transplant data, the article, which is now probably several months old, which suggests it was like 15%, then 40%, then 60% of what a vaccinated person would have after 3 vaccines, even begging a question, gosh, do they need a 4th vaccination? Which shouldn't surprise any of us, because when you suppress your immune system, you shut down your ability to respond to infections of any sort, whether it's a vaccine-induced, stimulus, or if it's just because this is why patients with cancer and on chemotherapy have more struggle with pneumonia or struggle with a viral illness more often.
And we're learning more and more about the specifics of that immunosuppression and what causes you to have lower responses, whether that's B cell and T cell. And it includes certain disease states like blood cancers, but also specific classes of those immunosuppressants as well.
Okay, we have a couple of more questions here that we'll do, and then all of these that we didn't get to today, follow up Friday tomorrow, all right? Craig asks, if someone who is fully vaccinated has a breakthrough case, does that person now have natural immunity?
I would say their natural immunity isn't any better than if you just got infected. Again, I think also calling it breakthrough is difficult to say. I know we've been using that. The disease itself is probably going to be a lot less impactful on you and your own individual health if you're vaccinated. How much will it increase that specific immune response of your B cells and T cells? Maybe a little bit. We certainly have seen that people who've had an infection and have gotten at least 1 dose of the mRNA vaccines seem to have higher antibody levels. We don't know really how that correlates with immunity, but we have seen that you have seen some sort of boost from there. So you may get some sort of specific T cell or B cell boost for Delta. And we're talking about Delta right now because that is the predominant variant going on here in our community at this point.
I think that's exactly right. And I think the answer is you really don't want to get Delta from some, because you just don't know, even if you've been vaccinated. So take the precautions and help protect others.
Yeah, Georgiana's got a really good question. I haven't heard this one yet, and that's kind of rare. She wants to know, when we're saying cancer patients, are you meaning those in active treatment, or if you've ever had cancer?
Yeah, a really good question, because not all cancer patients are the same. You can have a history of having had cancer. You could have had cancer with intensive treatment and you've recovered. You can have ongoing treatment, and not all treatments are the same. The immunotherapy population that gets a boost for the immune system to fight the cancer has a very different set of side effects and risks compared to the chemotherapy population or like the stem cell transplant population. The bottom line is this: get vaccinated, right? I mean, whether we have a history of cancer, whether you're in ongoing treatment now, get vaccinated.
Right on.
Okay, and we're going to give Sean the last question because it's on topic today. And he just wants to know, hey, I got some old sunscreen in my cabinet from last year. Is it okay if I just use that? What do you recommend, Dr. Doolittle?
I want you to use sunscreen. I want you to take a look at your old sunscreen and look for the expiration date on it. If it's expired, pitch it and get more. SPF of 30 or greater. Peak times during the day, absolutely. Don't forget to reapply, particularly if you're in and out of the water, every hour or two. So use the sunscreen. Take a look at the bottle.
That's a good question. Yeah.
All right, Jill, thanks. And yeah, we'll get to those other questions on follow-up Friday. And I want to get to final thoughts, and Dr. Doolittle, hopefully this will inspire yours, because Joe Cranston Woods, she wrote it and says, love Dr. Doolittle. My son's doctor for melanoma when he was diagnosed at age 22. Yikes.
That's really nice. Not about the diagnosis, just nice to
right. And so just what's your final message then to folks today, just as we head out and we still got summer to go and we're trying to protect ourselves? COVID's real, so is skin cancer.
Right. So from the skin cancer perspective, it's go enjoy your summer. Just protect yourself. Avoid the sun if you can from 10 to 4. That's not realistic if you're at the lake. If you're at the lake, sunblock, sun protective clothing, sunglasses. Seek the shade when you can. It doesn't make sense to give up on the things you enjoy, but it does make sense to protect yourself through that process. Then if we're just talking about the cancer population in general on the screenings, boy, come back. Get your screenings. It's safe. We're in a very different place now, the way we handle patients through the healthcare system. It's a safe environment, and putting off your screenings can make the difference between an early stage cancer and one that's later and potentially not curable.
And we're making it easy and free, so get signed up with that link for the free skin screening. Dr. Hawkinson, final thought?
Yeah, I think it was a good show. I think we talked about the dual pandemics of the vaccinated versus the pandemic of the unvaccinated, which at this point continues to increase, and those curves continue to split, where the unvaccinated are certainly at higher risk of having the whole spectrum of COVID disease, all the way up to severe disease and death. I think there's another pandemic that continues to go on, and we see it on a daily basis now, and that's the pandemic of misinformation or disinformation. So again, we try to present to you the best scientific evidence. We will support the scientific, medical, and public health guidance. But as we have seen, there are a lot of misinformation, disinformation campaigns. We know schools are starting. We know the ways to keep people safe. We know the ways to keep children safe, as well as all of the adults in those school systems. It is up to those elected officials to make those decisions on what to do and how to reopen schools safely. We know how to do it. Hopefully, all of that is taken into account, and we keep all of the children and their families and the adults in those schools safe. The first thing, though, it starts with getting your children vaccinated. You still have time before school starts. If you have any children at all over 12 years old, please get them vaccinated. There's a huge misinformation and disinformation campaign about it harms children, the vaccine harms children, it causes infertility. All of those are completely false. The other misinformation is that masks kill children. Children can't breathe with masks on. Those things are all false as well. So just please understand all of those things. Keep your children safe. We know they can be affected by COVID acutely. We know they can be affected by COVID long haul syndrome as well. So please do the smart thing. You still have time.
All right, Dr. Stites, close us out.
Yeah, you bet. Thank you, and I'll see you again on Tuesday. Hey, so I want to tell you something about Gary Doolittle you probably don't know. Yeah, here we go. So first of all, not only is he one of our finest physicians on this campus, he's won a Professionalism Award, which is the highest award we can give a physician. He's also won a Teaching Award as the best educator. He's had an impact on thousands of lives here at KU. So is Gary Doolittle one of our best docs? Yeah. Is he one of our best people? You bet. And you know what? I think it's people like that that tell you the truth. And it's what we try and do on this program every day. It's having people like Gary Doolittle and Dana Hawkinson, Jess, Jill, Anthony, Cliff, Logan back there running the studio. We endeavor to tell you the real truth every single day. Sometimes it's hard to hear, but we try to stay on message and make sure we do that. So we hope you pay attention. We hope you help us recognize the difference between telling the truth as best we know it on any given moment versus stuff that's just made up and doesn't make sense. And the funny part about that stuff that is made up, like masks can kill you, if you just sit back and look at it and say, wait a minute, doctors and hospitals and nurses and kids and cancer patients and they've been wearing masks for years and none of them have died from their mask. So how can that possibly be true? The answer is it can't. What you have to do is listen to people like Gary Doolittle. I'll tell you what, if I have skin cancer, I'm going to see that guy because he's the best doc there is. He probably would do duck and cover and try not to see me.
Dr. Stites.
He would try to avoid me as best he can.
Thank you.
But that's why you listen to this program. That's why we're going to keep telling you the truth, because we have people like Gary Doolittle and Dana Hawkinson on it with us.
I'm glad you brought that up. Somebody set up an interview with me at Dr. Doolittle, and they just said he's just kind of a big deal. And I told him, I said, are you kind of a big deal when he came and sat down? And he goes, I am not. I said, no, I think you are.
Actually, I think he kind of is.
That's the word on the
He
street.
has been for some time.
Yeah.
He has been for a long time.
So you're a big deal. We're going with that.
Thank you.
Thanks
for having us today.
You bet, you bet. All right. And thank all of you for being with us today. So, of course, like we said, Jill said, you sent in so many great questions this week. You know we couldn't get to all of them, but we're going to get after it tomorrow. It's Follow-Up Friday. Dr. Hawkinson's back. Also, Dr. Gary Morsch, founder of COVID Care Force. The cry for volunteers is going out again as COVID surges. Dr. Morsch has details on those needs. So, everyone, have a great Thursday. We'll see you at 8 a.m.
When you're part of the Made Up News Network, What you are really listening to is the ruries, the rumor reporters. Rumor reporters don't report facts, they report rumors. And the problem with rumors is they aren't scientific information. It's not stuff that's based in science.
Whoa, whoa.
I think it's all about where you want to get your information. Are you getting it from Facebook posts and TikTok, or are you getting it from the FDA, the CDC, other physicians who know what they're talking about? I know that certainly if I got diagnosed with cancer, I'm not going to go to TikTok and look to see what somebody says about what do I do now and what do I get for chemotherapy. So I think you have to understand where is your source of information.
At some level in life, you have to distinguish between that which is made up and that which is ruries, rumor reporters. Don't listen to the rumor reporters because they're not going to guide you based on science. They're going to guide you based on fear. But what we've tried to do in this program, and we continue to do, is to talk about the intersection of faith, hope, and science. But at the heart of each of those expressions is honesty and integrity, because we think ultimately that keeps you safe.